Okay, I've been bringing to you ways to compare and stop being conditioned by always treating the area of injury, on the side of injury too, and the direction of motion of the injury. So a lot of people know TMR, or think they know TMR to be treat the good side. But the reality is, so what I want people to understand is that we are about comparing motions throughout the body, all right, and using one that produces the best result. So I, as the founder of this, have been having, just for about the last 6 months, this problem with being able to lift my left hip upwards to like a knee to chest. It's been stuck. And I've tried the good side. I've done it in squats, in stabilizing exercises. I've done it in through range of motion through the air on the good side. I've tried it on the bad side. I've tried it on both sides. And I knew, and I was going to go to a chiropractor and get my SI adjusted and my pelvis adjusted and just see if that opened it up. But I said, I just want to keep trying this until I come up with something. I felt like a lot of it was in my rib cage, right? And just today, here's something I've learned, and I've noted about translations, but this is translation of the thoracic with weight bearing because it's going through weight bearing of the extremities. So I'm going to show you where my restriction is first. All right, and so here it is. So that's it. That's all I can lift. And it's like, it's just kind of stuck. It's not blocked like a hard block. It's just like, it hurts. Well, it just feels emptier, maybe even hollowish feeling. Where this one, no problem. And I can stretch it up here like this. If I do this one, I just don't want to move it. And so I've tried doing a bunch on the good. I've tried to do a bunch on the bad. I've tried to do both, all right, where I'm laying down and pulling up. I've tried to do weight bearing on one side, weight bearing on the other side. Seemed to happen. So I showed you in the last couple of videos about incorporating other parts of the body. Well, I've tried that too, where I've squatted down and rotated. Squatted down and rotated again on the good side. Squatted down and rotated on the bad side. Saw what changed. Well, today I was playing around after I filmed the other ones about motions, and I began doing this. So I pushed up against the wall, all right, and then I lifted. Okay, so pushed up against the wall, then lifted. All right, that's better. That's, okay, let me get my jeans. That's better. All right, so I can go and do that several times. All right, and see what the result is. Or I can push against the wall. I can turn around, push against the wall, and treat to the good side, or maybe even to the bad side. All right, and see what that does. So I'm going to turn around just for a second and see how the improvement is. Which one works better. Pushing, and it's just hard to keep that push going. All right, so I'm going to lean away from the wall, so I have to lean into the wall and come up. All right, away from the wall. So now I have to weight bear when I pick up the leg. I think, and then I'm going to try this way. All right, that feels pretty good. What I'm going to do is I'm going to do 10 sets, or 10 reps, and for right now I'm going to choose to do it to the good side, pushing with my good arm, which actually when I do it is this one, okay? So I'm going to do this. I'm going to push like this, and I am going to do this and see what happens. I'll come back and let you know. And then we'll go and do the, quote, bad motion side with this arm. All right, see what's happening. On. Weight bear, weight bear. 2, 3. And as I'm doing this, I'm getting cracks in my thoracic, which is nice. Feels good. I'm really trying to push against that wall as I do it. I should do 2 sets, but just for the sake of the video. That's pretty good. It's pretty good for me. All right, getting some. All right, so I could do some more like that. Now I'm gonna also do the bad just to see. Again, bad means It's still working though once I push against this, which is nice. I could go out further to see what happens. Just, that feels good too. In fact, that's getting more range in there. Yeah, that's getting nice range. So when I push against the wall, you gotta determine which one's better. This side doing it or this one? And really, the freedom of the hip really feels freer here. And the freer, the motion of the whole spine feels freer on this side. So I'm actually gonna call this my good side, or my easier side. I'm gonna see what it does to the other. So you gotta get away from the idea of labeling something bad. Just, we're always looking for freedom of motion. Now let's check it out. Yeah, that did it. Now I can at least pull on here. Yes! I've been looking for that for a long time. So, not sure whether that helps or whether it confuses some of you. Those of you confused, it's just because your mindset's targeted to one direction of motion that doesn't work. You're not thinking about two areas. For those of you other ones may say, that's pretty intriguing, not quite sure how to follow along with that. That's some upper advanced level TMR. Those of you who've been doing TMR a whole bunch, that's gonna go, whoa, I can try that out. So, hope you enjoyed that one. It's kind of neat on my part. I keep learning and I've been doing this for 10 years now. So, enjoy and hope to see you soon. So I want to see what kind of improvement I can get, all right? So again, you can fast forward through this some if you want to, but this is kind of fascinating to me because that's the best motion I've gotten in quite some time. I wish in a way I could get this even weight bearing more on my side, on my arm, I mean. But that's nice motion for me. Now, I have a harder time if I internally rotate and lift it up. So I'm going to try a little bit more of that. Not much yet. I'll stick with the... I don't know, that's probably only 8, but it gives me an idea. I should do 2 sets, but I'm just seeing how is it working. It's the best I've had in a long time. Whew, that's nice. That's really nice. All right, I'm going to go check this way. I don't mean for you to have to watch my butt the whole time, but I'm going to go to the good side, or to this arm with the quote harder motion. Don't like that. Do this one. All right. It feels pretty good. I do have a hurt shoulder on this side, so we'll see. We'll see what happens. I've got better hip motion on this one. Again, I'm not leaning on my arm much. I'm not doing translation as much as I'd like to. Or pushing into translation by weight bearing on the wall. But I can tell you, if you had problems getting people in the thoracic regions to free up, especially in the, seems to be mid to lower thoracic. Well, I wouldn't say too low, but. All right, so let's see what that did. That one, I don't like that one as much. Nope, so far I like this one with this leg. But I'm gonna try this one with this leg one more time, see what the motion's like. Yeah, see, that one hurts my SI when I do it. My left SI. So I'm way out here weight bearing. This is my, all right, let's try this. That one feels better though. That one feels actually pretty good. So again, sometimes I don't know which one's gonna work. It's like there's both of them. That one has a good feel to it. This one might be the winner in comparison to all of them. Starting to sweat. It's about 80 down here because I use a humidifier. Oh, that was nice. That, I think, is the ticket. Let me just do it straight on without in front of the camera to see. That's doing better. That's doing better. So either one seems to improve it. Well, it might be a little bit more, but I'm going to keep on doing this and seeing what I can get. Whew, hope that helped you. Hope that got you thinking. Now, this seems like, ooh, I just go and try things, boom, 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 and I do on myself. But when I do treat patients, and when I teach the TMR process, I show you the process in which I was thinking to get to this, but I teach it to my patients. There's very much a process from step A to step Z, and we take it one step at a time. So right now I'm up along step R maybe, but I've progressively gotten there. All right, so right now it looks like I just pulled some out of the dark and just started doing it, but actually there's a progression, linear progression to this. All right, fair? Well, I hope to meet you soon. See you now.